Healthy eating is necessary for a long, healthy life and is especially important for your heart health. Now that you've had a heart attack and have been diagnosed with having coronary artery disease, eating well is even more important for your health. In the hospital, your healthcare team advised you to lose excess weight, to improve your cholesterol levels, to lower your blood pressure, and to control your blood sugar levels if you are diabetic. Eating a heart-healthy diet will help you do all those things. Eating healthy will help you lower your cholesterol levels, lower your blood pressure, and lower your blood sugar. It also helps you achieve and maintain a healthy body weight. In this DVD segment, you will learn about foods that are bad for your heart. We will walk you through the important steps in helping you make the right food choices to achieve a heart-healthy diet. We recommend that the main cook and grocery shopper in your household watch this DVD along with you. If you are diabetic, the diabetic diet is the same as a heart-healthy diet. First, let's talk cholesterol. Cholesterol is one of the fats that are made by our bodies. Your cholesterol level had a lot to do with your chances of getting coronary artery disease. While you were in the hospital, your healthcare team reviewed your cholesterol results with you. When you were discharged, you likely were given a form called Patient Discharge Information Checklist that contains your cholesterol results. Please refer to your form. You will notice that your cholesterol level is broken down into 5 different parts. The first category is your total cholesterol. Total cholesterol is just that, the total amount of cholesterol in your blood, and includes your LDL, also known as your bad cholesterol, HDL, also known as your good cholesterol, and triglycerides. There is no target value for total cholesterol. The second category of your cholesterol result is your triglycerides. Triglycerides are fat carried in your blood from the food you eat. Excess calories are made into triglycerides and are stored in your fat cells throughout your body and are used by your body for energy between meals. Having a high triglyceride level increases your risk of heart disease. The target value for your triglycerides is less than or equal to 1.5. Drinking too much alcohol, eating a diet high in fat, eating too much sugar, or having poorly controlled diabetes can increase your triglyceride levels. The third category of your cholesterol level is your HDL. HDL is also known as your good cholesterol because it actually helps to lower your LDL or bad cholesterol. HDL helps to move your bad cholesterol from the lining of your arteries back to the liver for removal from your body. Raising your HDL will help to protect you against having another heart attack and decrease your risk of future blockages in your coronary arteries. The target value for your HDL, if you are a woman, is greater than or equal to 1.3. If you are a man, your HDL should be greater than or equal to 1.0. The fourth category of your cholesterol level is your LDL or bad cholesterol. High levels of LDL are responsible for plaque to build up in the wall of your arteries. This is the case with coronary artery disease when LDL fats and other materials build up in the walls of your coronary arteries. Over time, this buildup causes hardening of the arteries so that the coronary arteries become narrowed with plaque. When an artery becomes too narrowed, blood flow going through the artery is reduced, which increases your risk of heart attack as well as other medical conditions such as stroke. An LDL target value of less than or equal to 2.0 is recommended. The final category included with your cholesterol level is your total cholesterol HDL ratio. This number is associated with your risk of heart disease. The lower your number is, the better, meaning your risk is lower for future coronary artery blockages and heart attacks. Your ratio is calculated by taking your total cholesterol number and dividing it by your HDL cholesterol number. The goal for your total cholesterol HDL ratio is less than or equal to 4. So you may be wondering what all this cholesterol talk means for you. It is actually quite simple. Your goal is to lower your bad cholesterol or LDL, raise your good cholesterol or HDL. In doing so, you will hopefully decrease your triglyceride and total cholesterol levels, decrease your total cholesterol HDL ratio, and ultimately decrease your risk of future heart attacks and blockages. While in the hospital, you are likely started taking a cholesterol medication to lower your LDL. However, eating foods that are low in fat is very important to your heart health. Although this idea may sound simple, choosing the right foods can be very confusing. So we'd like to help you get started. The first few steps will focus on fats in our diet. Step 1. Reduce all saturated and trans fat in your diet. Saturated fat is mainly found in animal fat, like the fat found in meat, dairy products, and egg yolks. So when you are out grocery shopping, look for lean cuts of meat, such as chicken, lean, or extra lean ground beef. A hint is to look for a cut that ends with loin, such as pork loin or tenderloin, or round, such as round steak or roast. Also, look for meat alternatives like fish. Look for salmon. If fresh salmon is too pricey, go for canned salmon. Other meat alternatives are beans, soy products, and nuts. Maybe try a pot of baked beans minus the salt pork. Avoid cream and full-fat milk. Choose lower-fat dairy products such as 1% or skim milk, low-fat cheeses, yogurts, and other dairy products. Avoid butter, shortening, and lard. Choose soft, non-hydrogenated margarines over butter, and always measure out the amount you need. Non-hydrogenated is another way of saying the product doesn't include trans fat. Avoid eating fried foods. Broil or bake your foods instead of frying them. Use fat-reduced products whenever possible. Aim for 12 to 15 grams of saturated fat or less per day. Later in this video segment, we will talk about how to read a food label. Trans fats are other fats you need to avoid. These fats are found in commercially made baked goods like muffins, cupcakes, cookies, crackers, and French fries. Trans fats are used to make products that are more spreadable, such as creamy peanut butter. They also extend the shelf life of foods in grocery stores and also make fats more stable at high temperatures. They are especially unhealthy because not only will they raise your bad cholesterol, or LDL, but they will lower your good cholesterol at the same time. Look on the nutrition fact labels for trans fats and keep your intake to 2 grams or less per day. So avoid high-fat snacks and desserts. Not all fat is unhealthy for you. We all need some fat in our diet. However, it's important to choose fats carefully. Some oils in moderation are heart healthy, as they can help to lower our bad cholesterol or LDL levels. Healthier oils include vegetable, olive, canola, and peanut oil, but it's important to use in moderation. You should only use 1 to 2 teaspoons of oil per meal. Again, it is important to measure out the exact amount you need. Another important healthy fat that we all have heard about are omega-3 fatty acids. Research shows that omega-3 fatty acids lower your risk of abnormal heartbeats, can lower your triglyceride levels, and slow the growth rate of plaque buildup in your artery walls. Omega-3 fatty acids are found in fatty fish like salmon, tuna, mackerel, herring, trout, and sardines. Our bodies are better able to use omega-3s from fish, so we recommend eating fish a minimum of 2 times per week to improve your health. Omega-3 fatty acids are also found in flax seeds and certain nuts such as walnuts and almonds. A 1/4 cup of walnuts or a tablespoon of ground flax seeds per day will give you the recommended amount of omega-3s. Omega-3 supplements are acceptable to use, although omega-3 from food sources is preferred. Talk with your doctor before taking any supplements, as they may interfere with certain medications. Step 2. Eat more whole grain products. Fiber can help lower your bad cholesterol, or LDL. Look for the whole grain on food packages. Try whole wheat pasta, brown rice, oatmeal, oat bran cereal, whole wheat breads, and high fiber cereals. The average Canadian needs 21 to 38 grams of fiber per day. Step 3. Eat more vegetables and fruits. Vegetables and fruits are also very high in fiber. Eating 7 to 10 servings of fruit and vegetables a day may reduce your risk of future heart attacks. 1 serving is equivalent to 1/2 cup of vegetables or chopped fruit, 1 cup of leafy greens, or 1 piece of fruit. Canada's Food Guide recommends eating at least 1 dark green and orange vegetable a day, such as spinach, broccoli, green peppers, carrots, sweet potatoes, and squash. The darker the color, the more nutrients and antioxidants the fruit or vegetable will have, so eat up! By reducing the amount of saturated and trans fat in your diet, eating more whole grain products, and eating more fruits and vegetables every day, your HDL should increase and your LDL should decrease, and you will have better control of your weight. Next, we will talk about salt. Most Canadians use too much salt in their diet. Salt can raise your blood pressure and cause you to retain fluids, all of which creates a burden on your heart. High blood pressure causes extra pressure on your artery walls. This extra pressure means the heart must work harder to pump the blood against the increased pressure. In addition, consuming too much salt may also cause you to retain fluids. Excess salt causes the blood to hold onto water, resulting in swelling in your legs or fluid on your lungs. Therefore, step 4 is easy. Step 4. Reduce your salt intake. Toss the salt shaker out the window and use herbs and spices instead. Most of our salt intake comes from fast foods, eating out in restaurants, prepared meals like frozen dinners, processed meats like hot dogs, and luncheon meats. Canned soups and vegetables, bouillon cubes, salted nuts, potato chips, and condiments like ketchup, mustard, and pickles. By buying sodium or salt-free canned goods, limiting intake of deli meats and frozen dinners, and seasoned rice or pastas, you can really decrease your salt intake. Believe me, your heart will thank you for it. It is recommended you consume less than 6 grams or just under a teaspoon of salt a day, or less than or equal to 2,300 milligrams of sodium per day. Step 5. Select smaller portions of meat and alternatives. The portion size for cooked fish, meat, and poultry is 2.5 ounces, or half a cup chopped. If you don't have scales to measure 2.5 ounces of cooked fish, meat, or poultry, make your serving equal to about the size of a deck of cards, or the palm of your hand. 3/4 of a cup of cooked legumes, or 2 eggs, or 2 tablespoons of peanut butter, or a 1/4 cup of nuts or seeds. Women over the age of 51 need 2 servings of meat and alternatives a day, and men need 3 a day. Step number 6. Limit your intake of sugar. Avoid high-calorie beverages like soft drinks and fruit-flavored drinks with low % of juice. Sports drinks, energy drinks, punches, and alcohol. Look for a food label and avoid products with the ingredients that end in "ose", such as sucrose, glucose, and fructose, if they are listed as one of the first 3 ingredients. Step number 7. Learn to read a nutrition label. Here's an example of a label. First thing to look for is a serving size, as you may be eating more or less of what is considered a serving. Next, look for the % daily value. The daily value is really a guide to tell you if the product has a little or a lot of a nutrient. It is based on someone who eats 2,000 calories a day, which is what an average person would consume. A % daily value of less than 5% tells you the product is low in this nutrient. So look for 5% or less under the % daily value column for low-fat and low-sodium foods. Remember, it's only less than 5% if you stick to the serving size. This product has a % daily value of 5% for sodium, so it's a healthy choice. If the % daily value is greater than 15%, the product is considered to be high in that nutrient, which is great if you're looking for calcium, but if a product has 15% per serving of fat or sodium, it has too much fat or sodium, and you might want to avoid that product or look for a lower fat and lower sodium version. When you're trying to limit your intake of unhealthy foods, one helpful tip to keep in mind is that when you look at the list of ingredients on the food label, the first 3 ingredients that are listed on the food label are always the main ingredients in the product. This is the same for sugar, salt, and fats. Do not try to incorporate all 7 steps into your diet at once. Take it one step at a time. Choosing the right foods in the grocery store can be complicated, and changing how you prepare your meals can be a bit overwhelming at first. But it is worth it. You will feel better, and you are protecting yourself against future heart attacks. Just remember that you are not alone. There are great resources available in your community, such as meeting with a dietitian in the community, contact the Heart and Stroke Foundation of Canada or the Canadian Diabetes Association, and of course, Canada's Food Guide to help get you started. Let's recap the 7 steps to healthier eating. Step 1. Reduce all saturated and trans fat in your diet. Step 2. Eat more whole grain products. Step 3. Eat more vegetables and fruit. Step 4. Reduce your salt intake. Step 5. Select smaller portions of lean meat and alternatives. Step 6. Limit your intake of sugar. Step 7. Learn to read a nutrition fact label. Bon appetit!